Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Janet Jokela. She's an infectious disease physician and former treasurer of the American College of Physicians. Today's Kevin MD article is Collective Action as a Path to Patient-Centered Care. Janet, welcome back to the show.
Thanks so much, Kevin. Glad to be here.
All right, so tell us what this latest article is about.
Yeah, ACP came out with a new position paper earlier this year about collective action, and it just made me reflect on my experience as a resident when I was in a union at that time, and also the current landscape. Like, why are, physician unions and resident unions popping up all over the place? So that's where this came from.
Yeah, so I think we had talked about this before. I also trained at Boston Medical Center, and you were talking about your experience as an intern at the old Boston City Hospital. And I remember when I was training there, right, we were one of the few places that had a resident union.
Yeah.
And so during that time, so I think that collective action back in the, 1987 when you were an intern, that was a relatively uncommon thing, right?
Oh, I think so. I came from Minnesota, from Minneapolis. I matched at Boston City, and there I went, landed there in the big city, if you will. And they just said, "Oh, you're a member of the union." It's like, okay. I wasn't really sure what that meant.
Hmm.
But, at that time, I was really focused on, I need to learn everything to take the best possible care I can of my patients. I, was interested in the Red Sox. They hadn't won a World Series yet. And it's like, Fenway Park, the Red Sox and whatnot. And anyway, just trying to learn everything about what was going on, including the union. And then at that time, it seemed like most of the efforts of the union were things like, we need to decrease the amount of scut work that the
Yeah.
residents are doing. So it's things like difficult blood draws. Or at that time, we were accompanying patients from the emergency room to the floors as interns. It was the intern's job to push patients through the tunnels and get them up to the floor. So my recollection is those were the kinds of things the union was focused on then, and there we were.
From what you remember, how successful was the union in terms of protecting the rights of the interns and residents?
I think they were doing the best they could, with the tools they had at the time. Were we still tasked with, going to the patients who, no one else could get their blood? Yes. Were the interns still pushing patients through the quarters? Well, yes. But I think there were other things that they were working on too that perhaps I wasn't as familiar with. But things like our residents continue are considered students or employees. And at that time, the decision was made that, oh, residents are actually employees, they're not students, so they can belong to a union. So there were some fundamental things that were going on that, I just wasn't aware of, but there were a lot of other important things I think that were going on kind of behind the scenes.
Today, the concept of collective action is gaining traction within the physician community. I have a lot of articles on Kevin MD saying that physicians should unionize. I live just outside of Boston, so we both know the primary care physicians at Massachusetts General Hospital have unionized. So tell us now, what are some of the common issues that are fueling this new wave?
Right. It's a really important question. And I think it speaks to the rationale behind why physician unions are popping up. I think a lot of it gets back to the sense of burnout and moral injury, and also the fact that the landscape has changed. The majority of physicians now are employed compared to in the past. So that many times these employing organizations may not be quite in alignment with an individual physician's professional ethics, professional values, and then these things clash. And I think people feel like they have nowhere to go. They're a little bit stuck and they need some help to sort this out and to kind of better care for their patients and ultimately respect their values that they were trained to have.
So traditionally, there's been a belief that physicians should not engage in work stoppages. Certainly, that is a way that these collective actions can assert themselves. How is today's discussion reframing that concern?
Yeah, that's an important question. I urge everyone to take a look at the article. There's a lot of details in there and a lot of in-depth kind of review of the literature and sort of where we are today. And there's 8 separate recommendations. So with that, there's a lot of nuance in this and a lot of kind of rethinking physician unions. And absolutely, I mean, I've heard it, you've heard it, I'm sure, like, unions are bad, don't join the union, you don't want to be in a position where you abandon your patients. That's not what this article is talking about. This article is talking about a new avenue and a new approach to unions so that ultimately patient care would benefit, physicians would benefit, but it's in the goal of upholding our professional values where the union can be focused. And that's an exciting development.
So give us a sneak peek for those who haven't read the article. You said there are
Yeah.
some new ideas, some new approaches. Just give us a
Yeah.
synopsis about what some of those new ideas are.
Yeah, so for instance, with collective action, meaning unionizing and perhaps including the full range of activities like perhaps a work stoppage, that would be a last resort, a last resort, like a work stoppage kind of thing. That said, there are places that have engaged that, but for instance, if there are some physicians who might be involved in that for a short period of time, there might be other physicians who would cover for them so that patient care would not be adversely in fact impacted. I think the key piece is that patient care and our patients are prioritized as the primary thing and kind of our primary motivation, our primary focus, and which is super important. And I think that guides everything else. So any say actions or negotiations, mediation, that kind of thing would really revolve around, hey, this is good for patient care. This is good for retaining your physician workforce. And that's really important because if you don't have patients, they aren't going to get care. So in the big picture, in the long run. So those are some of the things that this paper touches on.
You mentioned that today's landscape, especially for primary care physicians, has changed, where the majority of primary care physicians are now employed. And sometimes, as in the Massachusetts General case, they often feel powerless. What
Yeah.
makes this group particularly vulnerable?
Yeah, I mean they're young, they're early, they're just out of medical school, they're residents, and as we all know, it is so easy, I think, for residents to be in an incredibly, and they're just an incredibly vulnerable position. So we don't want residents to be in a position where they're taken advantage of in any way, shape, or form. So even things like, earning a livable wage, if you will, is really important, especially in a big, expensive city like Boston or San Francisco or wherever they might be. That's critical. And even having avenues for childcare, like how is a busy resident supposed to navigate that if there's no easily accessible childcare right there for patients? And also the residents, I like to think of the residents as the canaries in the coal mine. They see what's going on in the hospital and they know where the pressure points are and what the problems are. So, for instance, if there's some equipment or something else that they know patients need, they can advocate for that. And collective action is one way for them to better advocate for that. And in many ways, also to help them to feel like someone's paying attention and really listening to them.
So obviously you've been involved with organized medicine for a long time now. You're in a senior position, and I've talked to physicians from across the country for many years as well. But how about those physicians who may not be in our positions, right? And they may not be accustomed and know what's going on. Tell us the type of questions they need to ask themselves when they're considering whether it's right for them to join a union or
Yeah.
not. What kind of questions or issues should they consider?
Yeah, great question. An important question. One is to talk to colleagues, talk to their immediate colleagues and get a sense of, from them as well. Am I the only one feeling this way or are other people, frustrated that, whatever it is, the time allotted for new patients has been cut from this to that. And that's just not enough time to take really good care of new patients. And there are those kinds of issues. And I think to keep the patient experience and the patient care as a central focus is critically important. And If one's colleagues are, in agreement or getting a sense that this is just wrong, I mean, like it starts to feel like this is just morally wrong. We can't do this. It's just wrong. And then if it comes down to either, making a career change or having to leave or quit or whatever, or come on, let's do what we've been trained to do and advocate for patients, that I think can make the difference.
So I know that our nursing colleagues as a profession has been more strongly associated with unionized action historically. And the concept of unions has been relatively new within the physician profession.
Yeah.
Anything that we can learn from our nursing colleagues when it comes to collective action?
Yeah, yeah. There's certainly been a lot more attention paid to nurses' unions and nurses' strikes and, things like that. Again, this paper in particular in ACP is not calling for strikes,
Okay.
if you will, that, physicians should go on strikes. That said, there may be avenues of collaboration with nurses and nursing unions, but I think that would probably be very dependent upon the local dynamics and the local scenarios and local colleagues and all of that. So there may be some things that we can learn from our nursing colleagues, and there may be some things that we can do together that's probably very regionally dependent in terms of what those might be. But yeah, the nurses unions have been in existence for a long time.
One of the things that you touch upon in your article is the concept of retaliation, right?
Yeah.
So, talk more about that and what kind of things that physicians should consider if joining collective action or joining a union, anything that they should be on the watch for when it comes to retaliation.
Oh, that's so important. It's just really important. I'm really proud of the ACP where they're saying, that's one of their recommendations in this paper is that physicians essentially should not be retaliated against, period. And I think it may help people in the trenches that if they're exploring this or considering this for themselves, if they can point to the ACP paper to whoever is in charge, that look at these are important considerations as far as kind of important criteria that we will uphold and we will honor as we go forward in this. And I think too that was one reason why ACP wanted to write this paper and get this out, because we know the landscape has changed. And again, there are people, residents, physicians joining unions in pockets around the country. It's important for them, especially, to provide some guidance and kind of a stamp of approval, if you will, that this is important for patient care and for the survival of our profession. So that's why it's important. It's not the professional guild of old where, we're just protecting physicians' interests. No, this is about protecting our professional integrity and protecting our professional ethics.
We're talking to Janet Jokela, infectious disease physician and former treasurer of the American College of Physicians. Today's Kevin MD article is Collective Action as a Path to Patient-Centered Care. Janet, what do you see as the future when it comes to collective action among the physician community?
I think it gives us hope. I think it gives us a sense of optimism and hope that there is a path forward, that this is important. And as long as physicians remain employed, there may be discrepancies between what the employer expects and wants and between what the physicians know is important and that what we're obligated to do. So I think the collective action avenue provides an opportunity to bring these groups closer together so that we can be enabled to provide the care that we know how to do and we know what's important to do.
And finally, let's end with some take-home messages they want to leave with the Kevin MD audience.
Sure. Thank you. Thank you, Kevin. Again, the landscape has changed. A majority of physicians these days are employed, and it's the collective action provides an avenue to help better align our professional ethics and our professional commitments with the employers thinking about what should happen and how things should be organized, if you will, in the practice. So,
Janet, thank you again for sharing your perspective and insight. Thanks again for coming back on the show.
thanks so much, Kevin. Glad to be here.